Hi everyone, very good evening to all of you, and welcome to another All Stars class to be conducted by Khaira Education. Very good evening. I can already see many of you are joining. So I would love to hear from all of you who you are and what are your professions. So I'm Sanya Mathur. I'm the head trainer at Khaira Education, and I feel very fortunate to be taking this class for all of you. So please do tell me what are your professions. Please tell me your names, and do also tell me that which countries you're from. It's always good to have students joining us from all across the world. So please feel free to write in the chat whether you're a pharmacist, doctor, nurse, dentist, physiotherapist, etc. And good evening to the ones who are just joining. So we are going to have an OET All Stars class today for the module of speaking, and we'll be tackling some of the common errors that students face in the speaking subtest. So as I mentioned, I'm Sania from Khaira Education, and Khaira Education is one of the Asia's first premium preparation provider, and we have three centers in Mohali, Delhi, and Amritsar, and we also take online classes. So it doesn't matter which part of the world you're from, you can always join us and take coaching from us. So here you can see some of the details of Care Education. So you can reach out to us through these numbers that are mentioned here. You can also follow us on Instagram and Facebook. We keep posting very interesting reels, which can help you with the preparation. So feel free to get in touch with us. And we offer a wide range of affordable courses depending on what your requirement is. And you can choose the course which is most appropriate for you. And we also have our course leader and the director of Khaira Education, Miss Gurleen Khaira, who has written 7 preparation books for OET, as you can see over here. And you can again reach out to us in case you want to buy these books. So yes, you know that you are at the right place. Now, also to give you a brief about the services that we provide at Care Education. So, as I mentioned, we are Asia's first premium preparation provider. So, we provide support for all the 4 modules of OET: reading, listening, speaking, and writing. So, there are online classes as well as offline classes. There is no difference between them. The only difference is that you will see the teachers physically or you will see them online, like you are looking at me right now. So, this is also pretty nice. And we will be providing you the entire material, so you won't have to purchase anything externally. So we also have group classes every day to enhance the skills pertaining to the 4 modules. We have one-on-one speaking sessions as per the students' availability. So we have trainers who are available like throughout the day, in fact. And whenever students tell us that this is the time where we want to do the speaking session, so then we arrange that for the students. Then we have flexible timetable for working healthcare professionals. So we have a morning batch, we have an evening batch, and all our lectures are recorded and shared with the students right after the class. Then we also provide the service of making personalized study plans. So as we all can appreciate that many of you are working and maybe you can't dedicate a lot of time during the day to your classes. So in that case, we can make personalized study plans for you. And last but not the least, we will have round-the-clock assistance available from our staff members and trainers to offer any help to you whenever you face any obstacle during the course. So yes, you can join us today, and we will have some exciting offers coming up soon. So please stay in touch, right? So yes, with that, let's begin the class for today, which is about the module of speaking. So let's quickly discuss what is the format of the speaking test. As I can understand, some of you might be attempting the test for the first time. So here's the format. So the total test of OET speaking will be of 20 minutes. Firstly, you have an ID check that happens with the interlocutor. After that, now this is where the actual test begins, you will have a warm-up section. So in the warm-up section, the interlocutor is going to ask you some questions related to your job, your daily routine, Now, this section is not assessed. It is just so that your nervousness can come down and you can get a little used to the interlocutor. So rest assured, you're not going to be marked for that section. The two role plays would be the major thing. So for each role play, you will have a new cue card. The cue card will contain a setting, background information, and several tasks. You will have 3 minutes to prepare for the role play, and for 5 minutes, the whole role play will take place. Similarly, then you will get a new role play card. You will have 3 minutes to prepare, and for 5 minutes, the role play will take place. The cue card will stay with you throughout the duration of the preparation as well as the role play. So that means for 8 minutes, the card stays with you, and you can make any notes that you want on that role play card. There's a common misconception that you have to memorize or you can't write anything. So no, that's not true. So yes, this is the format of the speaking test, and today's class will be about the common errors that students make and also how we can avoid them. So in this class, we will learn about the most common errors that happen in the OET speaking, while number one, starting the role play. I can understand that many of you already struggle with the introduction, whether we know the patient or not. How do we begin the conversation? Second, I will be discussing what common errors happen while we are completing the tasks. And lastly, the conclusion part. Here also sometimes students are not aware that how can I properly end the tasks and close the role play. So that's also what we will be discussing. So starting with the very first thing, what are the errors that happen during the introduction? So number one, the students don't focus on the setting and the background information to initiate the interaction appropriately, and thereby they don't know whether the patient is known or unknown. Right? That's the number one error that we see every day. Second thing, students also don't keep in mind the emotional state of a patient when initiating the conversation. This is written in your background that the patient is anxious or the patient is upset. So that can be kept in mind when you are starting the role play. And sometimes students start with a close-ended question. So these are the three main errors that happen in introduction. Now let's focus on how we can fix them. So number one thing is you have to introduce yourself and your role in a confident and friendly manner because it will help in establishing rapport with the patient. So there is a criteria that you are assessed on. It's called clinical communicative criteria. And there is a sub-criterion of relationship building, which is of 3 marks, and you have to get at least 2 out of 3 in that. So in order to do that, you have to initiate the interaction appropriately. So introduce yourself and then um, take their name. That's very important, or ask their name depending on what the task is. Now, how you start the role play depends on the context. You might get a new patient where it becomes essential that you introduce yourself, or at times your cue card may suggest that you already know the patient. So sometimes the introduction would not be necessary. And to understand, you have to try to understand whether it is a known or an unknown patient. So let's try this example right now. Here you can see that the setting, the background information, as well as the first task is written. What I want all of you to do is, I want you to think about how you would be introducing yourself in this scenario. And after you are done reading, here are 3 options for you, and you have to choose the most appropriate introduction out of the 3 that are mentioned over here. So I'm giving all of you some time. When you're ready, you can type your answers in the chat. You can write A, B, or C, depending on which you think is the most appropriate introduction. Please go ahead. Okay, some of you have started typing in. So in this case, we can see the first hint in the background information. It says you are seeing your 28-year-old patient. And here we can also see that the patient has had an ultrasound recently with you. So, as most of you guessed it correctly, it's B. So this would be the appropriate way to start the introduction. Now, why is B the most appropriate introduction? Because the patient is known to you and has already had her ultrasound done at your facility. And this awareness, being aware of this fact, will help you initiate the interaction appropriately. Now, a couple of things to notice. First of all, the nurse here or the other healthcare professional use the name of the patient. So that shows the awareness that you know the patient already. So here you can see that no name is given. Still, the healthcare professional assumed a name, which is absolutely acceptable. If it is a known patient, there are two things you can do. During the 3-minute preparation time, you can ask the name of the patient from the interlocutor, or when you start the role play directly, you can assume any name. Um, Another thing you will notice here is the healthcare professional also said, "Good to see you again." That's also showing the same awareness. And lastly, this is very important. This healthcare professional started with an open-ended question. Instead of directly saying that, okay, your results are bad, they indicate this. No, it's very important to begin the conversation in a natural manner. So instead of directly going into and jumping into the first task, an open question. How are you doing today? Yeah. So this is very important. Opening the conversation with an open-ended question rather than a close-ended question. Right. So let's see if all of you can now do another one. So here you have a task. So you can see the setting, background information in the first task. I want you to take some time and think about how you will start this role play. And I want you to quickly write it in the chat. Maybe just 1 or 2 lines. How will you start this role play? Please go ahead. So yes, it's an emergency department, and we don't exactly know that the patient is known or unknown. However, please note that in the emergency departments, what happens is that whoever is sitting at the front desk always takes down your details and passes it along to the nurse or the doctor who's taking care of you. So that means they know the name already. So in that case, you will have to confirm the name. Okay, so as you can see, this is how the role play could begin. Good morning, I'm Jennifer. Am I right in thinking that I'm speaking to Jamie's mother? Now, you see, this healthcare professional did not say, "I'm Jennifer, I'm one of the nurses working in this emergency department." Not needed because it's an emergency. So that's why we have to be very quick in our introductions here. So if we can keep it very concise and to the point, that would be great. Now, as you can see, it's a parent who has come with the son. That means the son's details would be written in the case notes. That is why this is an appropriate way to start this conversation. That am I right in thinking that I'm talking to or I'm speaking to Jamie's mother? Suppose the carer says, yes, that's right. So you can say, thanks for confirming. May I know your name, please? And the carer says, it's Mary. So you proceed with that. All right. So tell me what happened. Yeah, so that's an appropriate way to start a conversation if it's an emergency department. This kind of awareness we absolutely have to show in our role play. Okay, so that's how we can correctly begin the role play. Yes. So now let's talk about the second part, which is that there are some errors when we are completing the tasks. So what are those? We will be discussing some of them. Number one, Sometimes students don't give patients a chance to speak by making the conversation one-sided. As teachers, we have experienced this so many times that if suppose five tasks are there, many students just one after another keep completing their task without understanding or without knowing whether the patient is even able to follow them or not. So we have to really strive to understand that it's a conversation. Just like you talk to your friend, there is a back and forth flow of information, and that's something which has to be ensured. Secondly, sometimes students rush to complete the task because of the time pressure, and they don't elicit concerns from the patients before going to the next task. There is a very common misconception that completing all the tasks is compulsory. And if you don't complete all the tasks, that will lead to loss of marks. Well, not really. So, of course, you have to try your best to complete all the tasks. But suppose out of five or six, you're just left with one, that's not going to have much implication on your marks. It is following all the correct techniques that will give you the marks. So, don't rush and do the tasks like that. So, you have to try your best to cover as many tasks as possible, but don't neglect using the proper communication skills, as that will lead to loss of marks. Okay, so please remove this misconception in your mind that I have to complete everything in 5 minutes. There is no criteria for task completion. You are marked on the basis of how effectively you communicate with the patient. Right. So, how can we fix this? Yes, how can we avoid these errors? How can we prevent us from making these conversations one-sided or not rush and make sure that the patient is with us? Firstly, by signposting, so that it becomes easier for the patient to keep track of the conversation. Signposting indicates a change in topic. So, whenever you're going from one topic to another, by using some of the appropriate signposting phrases, you will be able to ensure that the patient gets that now you're going to the next topic. Now, some of the example of signposting would be firstly, secondly, lastly, moving on, next, let's do this. Now I'm going to talk about this. This is signposting. Secondly, you have to remember not to use any medical jargon while explaining any medical terminology. So, of course, there are some medical conditions which we can't paraphrase, but you can always ask that, have you heard of this before? Or if there are some complicated names, for example, of certain bacteria, etc. So please use lay language. There was one task in which the patient had to receive warfarin injection, and it was described as an anticoagulant. Now, the patients will not understand that. So, you can simply say that it's a medication for thinning your blood. Simple as that. So, we have to use lay language. Sometimes, in a rush, students forget that. They just read the tasks as it is. So, no. When you're preparing for your task, maybe you can underline these things already. That when I do the task, I have to change them into lay language. And lastly, you have to present the information in chunks. And after every chunk, check for patient's understanding by using pauses or questions like, is it clear till now? Are you with me so far? Do you want me to repeat anything? Do not give all the information all together, as that's gonna hamper your performance. And also, if you give too much information without any pauses, without any breaks, you will not be able to fulfill the communicative criteria, especially the one in which chunking and checking is included, like information giving is of 3 marks, providing structure is of 3 marks. So chunking and checking is a part of both of them. So if you don't do it, you're losing marks in two separate sub-criteria. Right. So let's see how this can be done. Yes, so here we have one setting of, again, emergency department. So we had seen this already. Now we did the introduction for this. Here are two tasks that are there. This is task 3 and 4. You can already see there's a lot of information here. Firstly, I want all of you to properly read whatever is written in this task, in task 3 and 4. And then I will try to give you an example of how students do it and how it is supposed to be done. Go ahead. Yes, so I think all of you have read it. You don't have to do anything. I just want you to listen to my example. Okay. So suppose I'm a student. Um, so I'm directly starting with the third task. Okay, so Mary, I want to explain to you the next steps now for Jamie. So we'll be removing the nail, which will be easy because it's not bent. We'll wash the wound, apply the antibiotics, and administer tetanus injection. And also, I want to tell you that nails, especially the ones that are dirty, they have this bacteria that causes tetanus, and if it enters the wound, it's going to be very devastating. It might lead to very serious symptoms, which is a high possibility in this case. You see, no transition, no proper transition, just directly without any pauses, just going ahead and describing everything. So that's something which has to be avoided. Okay, so maybe let's see how this task can be done. So we'll be making use of two things here, signposting and chunking and checking. And let's try to do the third task. Okay. So the appropriate way for a healthcare professional to start is by saying this. So the healthcare professional can say, so now I would like to explain to you the next steps for management of the foot. May I proceed with that? Now, this is a very important phrase. Here, the healthcare professional is making sure that the parent is ready to receive information. So this is a very good way. Before just the brackets, you can quickly ask that, may I proceed with that? Um, let's assume that the carer says yes, and then the healthcare professional can say, thank you. Firstly, we will remove the nail from the foot, which will not be that difficult as the nail is not bent. After removal, we are going to thoroughly wash the wound. Are you with me so far? You see? A quick check. Now, if you notice, the tetanus vaccine part has not been covered yet. Just after informing about two things, the healthcare professional has taken a pause. That's very important. And then, okay, next we are going to apply the antibiotic so that the wound gets properly treated. And in the end, we are going to administer a tetanus vaccination. Do you know what a tetanus vaccine is? Right. So just to make sure that the parent is aware, and then the carer in this case says, yes, I'm aware of it. Okay, thank you for informing. Do you have any questions about what I have told you so far? So this healthcare professional did not jump directly to the fourth task after informing everything in the third task. Very compassionately, if I can say that. The HP stopped and asked, do you have any questions about what I've said? Because this is new information that you're giving to somebody who's not of the medical field. So we have to make use of these techniques and we have to do chunking and checking. So now I want all of you to do something. I want you to identify which are the phrases or words um, which indicate signposting over here. So maybe you can revisit the conversation on the left and just write whichever words you are able to spot that show signposting. Please go ahead. So I think firstly is the first thing that all of you noticed, but there are some other also. So some of you are guessing incorrectly. So let's have a look, everybody. The first one is so and now. So now, the moment anybody says so or now, that means there's a topic change. Second is firstly. Then after removal. So again, we are moving to the next topic. After this is done, then what are we going to do? Okay, next. Then after that, the HP said, and in the end, that's another signpost. And then even okay, I think okay, that would also be a good signpost. So generally, we don't notice these things, but these are also very good signposts for you to use in your role play. And signposting carries marks in providing structure, which is of 3 marks. So I highly recommend that you use these phrases. Also, you can just Google what are the other signposting phrases or words that are used in speaking, so that you can have some more examples ready in your mind. Now let's also look at some of the chunking and checking phrases. The first one we can see is here. May I proceed with that? You're just making sure that the patient is ready to receive information. Then, are you with me so far? A very good way of checking if the patient has been able to follow you till now. And lastly, this part, do you have any questions about what I have told you so far? So that we don't rush and go to the next task. Now, all of you might be wondering that I've skipped this part. Do you know what a tetanus vaccine is? Well, that is not exactly chunking and checking. This is something else. Here, the healthcare professional is trying to establish what the patient knows already, also a very important technique. Suppose if you even diagnose the patient with something like diabetes, it's never good to assume that the patient doesn't know anything or that they know everything. The way to know for sure is to ask them that have you heard about this before, or do you have any knowledge about this before? Okay, so establishing what the patient knows already is very important. Right. So if you do these things, you will be able to avoid the errors of keeping the conversation one-sided or just rushing through the tasks. There are some more errors that students make, like not keeping the conversation patient-centered or showing empathy just like a formality or giving false reassurance to the patient or giving advice in an instructional tone. What I mean by that is that sometimes it seems like you are ordering the patients rather than giving them advice. So let's look at it one by one. Now, not keeping the conversation patient centered is a very common error. So, what you have to ensure is that throughout the role play, you should keep eliciting the patient or carer's concern. So, you should keep asking questions like, I can see you look very anxious. Would you mind telling me what's bothering you? Or how are you feeling at the moment? So, it's not that only in the beginning we can say these things. Even in the middle, suppose you have just given a very bad news. Suppose if the patient comes to you to discuss about the results and maybe it shows cancer, malignant cancer, for example. So in the middle also, they can start feeling very anxious. So it's absolutely okay for you to ask that, how are you feeling at the moment? Or even when you give some advice, you can say that, what do you feel about what I'm proposing? Or how does that sound to you? So keep doing that so that you don't take over the conversation and you keep the patient or carer equally involved. Now, the second part is very important. It is not to give any false reassurance to the patient and showing actual empathy, right? So, when a patient exhibits anxiousness or concerns or fears, it is imperative to show that these concerns or fears are real and important. So we should not dismiss them that yes, everybody feels that way. No, you must show the patient that you understand what worries them. However, the reassurance has to be truthful and genuine, otherwise, it can become false reassurance. So, suppose if this is what the patient says, I have never been dependent on anything my entire life. I don't like the idea of being dependent on medication for the rest of my life. I can endure the pain. So, if this is what the patient says, I have two responses over here. And I want all of you to read thoroughly these responses and try to figure out that which one is the most appropriate one. You can write A or B in the chat. Okay, so some of you have started getting it right. So A is the right response for this one. The problem with B is that this response says something which is not true. Which is that everything will be fine. We can never say that for sure. And the second, the healthcare professional here is promising something which may not happen, that it all works out in the end. No, we can't say anything like that very lightly. So these are all false reassurances. Also, this phrase, don't worry, is used a lot by so many students. Don't worry, no need to worry, everything will be fine. We cannot say that. If you look at response A, there are very good phrases that have been used that I understand your perspective, that will make the patient feel at ease that, okay, somebody is finally understanding what I'm trying to say. And the second good phrase is that your concern about being dependent is quite valid, right? And then the assurance you see is that it's a temporary arrangement and it's highly unlikely, not that you will not be dependent, but it's highly unlikely that you will become dependent on them. So that's why response A is what you all should aim for. Of course, this is not a template. You can modify it whatever way you want. But yes, make sure that you avoid false reassurance. Empathy always comes from actually trying to understand where the patient is coming from. Right. So now the third thing is, as I discussed earlier, that sometimes when we give advice to patients, it's like an instruction or an order. Now we can fix that by using a technique called labeling. So let's explore it further. So labeling is a communicative technique which is used in healthcare. It is like a behavioral nudging, which involves subtle cues or label words to encourage the patient to make healthier choices or to convince them about some treatment. And we can do it by attaching a label to the advice to persuade the patient. So these are some of the examples for that. Instead of saying that you should not smoke or you should take some steps or you need to do this or you must do this, rather than that, we can see the labels as you can see they are underlined and written in bold. So we can say it is imperative that you take some steps. It is vital that you cut down on your drinking. It's essential that you take your medications on time. And if you see in the last one, there is a positive label which is important and there's a negative label which is dangerous. Both of them are acceptable. Instead of saying you shouldn't do this to your health, we can say that it's important for you to reduce the number of cigarettes that you smoke, otherwise, it would be dangerous. So we are making them aware of the risks. So we can also say it will be risky for your health, it could be dangerous, it might be harmful. So use these label words rather than directly saying you should or shouldn't do this. Also, a person is most likely to listen to you when you frame your advice in this manner. So, this is again a very common error, but it's important to use this technique. It's important in providing structure. It will give you marks there. Okay. So, further, let's move ahead and talk about the errors that can happen when we conclude the role play. So we are coming to the end, we are nearing the end. So the first mistake that students make is thinking that a proper conclusion is mandatory in every case. Well, no, it's not always possible. As I said in the beginning also, that it might happen that sometimes you are left with maybe one task, or maybe you've just started the last task and your time is up. That is absolutely okay. You are not being assessed on whether you were able to complete all the tasks or not. So don't worry if suppose you're not able to do the last task or not able to end the role play properly. Now, the second side of that is sometimes when students do have some time left, they abruptly end the role play, even if they've finished all the tasks. So we will also discuss this further. That how can you properly wrap up the role play? So let's have a look. So here is one of the last tasks of a role play card. I want all of you to quickly have a look at it. So it says, advise the patient to come to the emergency department immediately in case of any prolonged bleeding. So that is the last task that suppose you have to do. Now let's consider an example, and I want you to tell me with a yes or no that is this an appropriate way to end the role. So suppose if this is what the healthcare professional says, lastly, please come to the emergency department if you experience any prolonged bleeding. Will that be doable for you? So that's a very good chunking and checking. Will that be doable for you? Now the patient says, yes, I will do that. And the healthcare professional says, okay, thank you. And it ends there. So please write in the chat if you think this is appropriate. So yes and no. And also if you can just write in one line, why do you think this is not appropriate? So yes, it is definitely not an appropriate way to end. You see, it ended very abruptly. Will that be doable for you? Yes. Okay, thank you. No. So what are the appropriate way to conclude the role play? So the first thing that you can do to end the role play smoothly is by asking if the patient has any questions or concerns. So you can say, do you have any questions or concerns? Or before we wrap up, is there anything you would like to ask? That's a very good way of ending, like one direct question to make sure that even the last information that we have given, maybe they'll have questions about that. So they should feel free to convey that to us. Secondly, we can reiterate or summarize the discussion or the advice provided during the role play. So sometimes students do this when some time is left towards the end because we really have to make sure that we don't stop talking. It's always the interlocutor who should stop us. It's never a good it's never a good thing if we stop midway and we are just looking into the eyes of the interlocutor. So it's always good to keep the conversation going. And this is one of the ways to do that, summarizing the discussion. So you can say to summarize what we have discussed today, or just to go over what we have discussed today. And you can even use the word reiterate to just reiterate the important points of today's conversation, and then you can repeat them. Now, yes, there's another error that students make. It is that they start summarizing each and everything by saying that, okay, so you presented to me today and you told me you have pain, fever, vomiting, and then I told you this, and then you told me that. We are not reiterating the entire story. We have to just summarize the most important details of the conversation. So maybe if you have given two, three pieces of advice to the patient, maybe that you can repeat. Yes, so that's the appropriate way to summarize by not focusing on each and everything. Then what else can we do? We can let the patient know what happens next. So you can say, I will now just call radiology and you will be taken for x-ray soon. Is that all right? Again, these are situation specific. Or if it is appropriate, you can also fix another appointment. That how do you feel about visiting me in a week? For example, you have just told the patient to follow a diet or maybe to take some medicines for a week. That will be written in your role play card. So this is another way you can conclude yourself, even if it is not written in the task. That how do you feel about me, about visiting me in a week? We can then review the progress that you've made, right? And lastly, you can give an information leaflet. Again, this you can do if it is appropriate. Suppose if a patient is hospitalized and will continue to be hospitalized for another week, then you don't have to give them a leaflet. They're like right there in the hospital. So yeah, unless they really want it, then you can. So you will have to use your judgment for that. So you can say something like, I will just get the patient information leaflet for you regarding the oxalate-rich foods you need to avoid. And you can press the buzzer in case you need anything else. This is appropriate in a hospital situation. In clinics, they will not have the buzzer. Yeah. So these are the appropriate ways in which you can conclude or end the role. So yes, this is how we can fix some of our errors. So this is all that I wanted to discuss with you. Now I will also be concluding by summarizing. So with the techniques that we have discussed in today's class, you will now be able to, number one, start the role play appropriately. You will be able to complete the task efficiently and conclude the role play properly. So that is all. If you have any questions, you can right now mention in the chat. I will be there to answer some of the questions. And meanwhile, thank you for joining. And here are the details that you can see on the screen. You can join us anytime. You can contact us through these phone numbers. And you can also reach out to us on Instagram and Facebook. We look forward to hearing from you. And do tell me if you like this class. We'll be having many more in the future as well. And yes, if you have any questions, please post them. I will try to answer as many as I can, along with some important links to the blogs that some of us have written. So thank you so much for joining, everybody.